The views expressed in this webinar do not necessarily represent the views, policies, and positions of SAMHSA, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. So like I said, I'm with the Southeast PTTC. We're located at Wake Forest University, and we serve the 8 states in the Southeast region of the U.S. So the PTTC network began in 2018, and it's funded by SAMHSA. And it is comprised of 10 domestic regional centers and 2 national focus area centers. And the real purpose of the PTTC network is to improve implementation and delivery of effective substance abuse prevention interventions and provide training and technical assistance and outstanding webinars like this one today to the prevention field. So we are going to have an evaluation after this webinar. You'll be asked to complete our short little survey. And then from the survey, you'll be able to go to a link where you can customize your very own certificate of attendance. This is the little QR code that will take you to our evaluation. It's pretty short. We really appreciate your feedback, and so does our funder. So you can put your camera right over that, and it will send you there. You can queue it up for now, or I'll have this up again at the end of the presentation. But once you complete your survey, it'll thank you for doing that and then say you're going to be redirected to this link, or you can go on and click to it. And down at the bottom of your screen is where you'll see the certificate. It's a PDF. You have to customize it and then save it to your desktop so you have proof that you participated today. This is our agenda. So Dr. Wolfson is going to introduce our speaker, and then Cassandra Tourre is going to do her presentation. Then we'll have Q&A. So during the presentation, please feel free to put questions into the chat box or the Q&A. The chat box is usually a little easier for me to track. And we will be pulling up your questions at the end and sharing them with our presenter. We'll have quick announcements and then the evaluation. So with that, I'm going to turn it over to Dr. Wolfson to introduce Cassie today.
Thank you, Kristen. Can you hear me okay?
Yep.
Terrific. Well, we are so excited to have Cassie here for part 2. Hopefully many of you were with us for part 1 of this webinar. Cassandra Tourre is the Director of Public Policy at the National Alcohol Beverage Control Association, or NABCA. And NABCA is a trade association that represents alcohol regulators. She has extensive experience, over 15 years of public health experience in the area of regulation, enforcement, and marketing of alcohol. So prior to joining NABCA, Cassie was a faculty associate at Johns Hopkins School of Public Health, where she worked on both statewide and national projects implementing and assessing strategies to address excessive alcohol consumption. And before that, she was with a statewide advocacy organization called Project Extra Mile in Nebraska. So she has a ton of great policy experience, advocacy experience. She received her Master's of Public Administration from the University of Nebraska at Omaha. Hopefully many of you were able to participate in the webinar 2 weeks ago on November 4th, which was part 1. If you missed it, please visit our website to review the recording. So Cassie, take it away and tell us about shaping the alcohol policy environment, past, present, and future.
Thank you, Mark. Thank you so much. I mean, I have been so fortunate to spend my career in alcohol policy, and I starting off at young 22-year-old, fresh out of college, and I got tied up with a great organization, and it really just paved the way for the rest of my career. And while NABCA isn't an advocacy organization, Mark is correct. I have spent a fair bit of my career advocating for evidence-based public health policies in relation to alcohol. And so I am delighted to have an opportunity again to speak with the Southeast region and just share some of my knowledge and expertise, if you will. And so with that, I'll jump right in. So the first question is just to give me a sense of how many of you participated in part one, just so I know where I may need to do a little bit more unpacking in some of the components that we're going to talk about. So if you could just take a moment to take the poll. I think Kristen will be opening it up here. There it is. If you could just take a quick moment to let me know if you participated in part one. A, yes, wouldn't have missed it. B, no, but I wish I had. And of course, it's great that they have that up on the portal where you can still go back and check out what we covered in part one. So we'll just give it a minute here, and the poll's closing now. There we go. Okay. So most of you, it's kind of split, half and half. So that's helpful to know. Alrighty, let's jump right in. So we're going to be talking about factors that are driving policy changes related to alcohol. And then to sort of provide some context of some of the principles that we're going to talk about in alcohol policy, we're going to talk through some case studies of groups that I know that have been on the ground doing this kind of work, like many of you probably are in your own communities. And then we'll have some takeaways and then open it up for question and answer. And you may see I'm going to jump a few slides, perhaps based on timing, but trust me, you're still going to get a very deep and rich presentation here. So these three factors we're going to focus on are, there are really three, as I see it, primary factors driving legislative and regulatory trends related to alcohol. The first is public health crisis, which I think we all know what that is. Of course, it is the COVID-19 pandemic. E-commerce, which we touched on a little bit in part one, but we're going to dive a little deeper on, which is direct shipping and home delivery of alcohol. And then finally, I'm just going to briefly touch on federal courts, but there's a lot more to unpack on that front, but I will mention it because it is driving changes at the state level. So we should talk just again about three branches of government where we're seeing regulatory changes happening. And so we are seeing certainly legislative is the one we all probably immediately think of where we see policy changes happening at the legislative level. But of course, in the midst of COVID, they have been happening rapidly in relation to alcohol at the executive level. The governors have issued executive orders changing policy availability of alcohol in many communities across the country. And then finally, the judicial branch, which again, we're going to touch on with the federal government, but obviously there are things that happen in the state and the Court of Appeals as well. And just a few legislative pathways in which we see some of these changes taking shape, and some of the case studies will go back to this. So task force initiatives to study alcohol policies to address some of these sort of risk factor trends we're seeing in terms of e-commerce, the three-tier system, which we will talk more about in the e-commerce category, this drive towards convenience and consumer choices, and then finally the craft alcohol movement. These are sort of big picture things that are driving legislative changes, and these are often the pathways in which we're seeing changes happen at the legislative branch. So diving into the public health crisis, of course, as I mentioned, the COVID-19 pandemic has made sweeping and rapid changes to alcohol policies, perhaps faster than we've ever seen before on this front. And this is just a quick screenshot from our website, nabca.org, where you can see our full interactive dashboards day by day tracking policy changes. This is as of September 17th, so it is out of date, but on our website by Thursday, you should see a more current iteration of these dashboards. But the idea here is that we're tracking all these executive orders in every state to unpack how alcohol availability is changing in the context of COVID. And we've seen most of those changes happening with bars and restaurants for sure, where they have had limited seating availability or full closures in some cases. And when they do that, they have often been provided the additional privilege to have curbside pickup of sometimes alcohol, sometimes just food, just depends on the state, and then ultimately home delivery as well. And this is focusing specifically on distilled spirits because prior to the COVID moment, spirits were less likely to be able to have access through curbside or home delivery. So that's just important context. Historically, in this country and elsewhere, we've treated spirits differently. We have a higher tax rate for spirits. We have more restrictions in where it can be sold typically. And that's just how it's always been done. And of course, if you live in a controlled state like North Carolina, Mississippi, Alabama, the state is in the business of selling spirits. Again, under the notion that spirits are different and need to be more closely regulated. So that's sort of the idea behind spirits and regulation in this country. And so in the midst of COVID, some of that has changed a little bit in relation to spirits, but certainly other beverage categories as well. But you can learn a lot more about what's happening on COVID and alcohol if you're curious. Just know we're tracking it at the state level, not all the way down to the locality, which some you can see here on this slide, that states do vary by locality in some cases. And so in those moments, we just note that, but we're not tracking it at the local level, primarily because it's a complicated landscape and it's not enough time in the day for that. But still, you'll at least know that there's some variation at the local level. So I think, I heard one particular researcher describe COVID in this way, and I found it to be really helpful for me to see the context here. COVID and alcohol, it's a bi-directional relationship. COVID-19 and community transmission is being impacted by alcohol consumption in some cases where, bars and other restaurants perhaps have been identified as super spreader or had super spreader incidents. And then in context, of course, consuming alcohol can pre-expose you disproportionately to perhaps get COVID, or once you have COVID, to have really extreme experience that otherwise you may not have had you not been a regular drinker. So these relationships are really interesting to unpack, and certainly these, again, it's bidirectional. It's not one or the other. There is an impact happening here that just alone could be done, one presentation on this topic alone. But in interest of time, we're going to move on to our second category that I think many of you are experiencing in your community. I know I certainly am in my own here in Virginia, is e-commerce. Consumer demands are really driving the push for convenience across all products really in the marketplace. But really on alcohol, this is a growing trend. It was happening before COVID, and we'll talk about that briefly, but it certainly was expedited quite a bit in the midst of COVID. But in order to understand home delivery, I want to make sure we're all back to kind of square one, the basics of how we have the three-tier system in the United States. This is a critical element to understand how the product gets to market in this country. It is unique to this country, but what it does is it ensures 100% tax collection, near 100% tax collection in this country, and it helps us track down tainted alcohol products if they ever enter the market. And that primarily happens in that middle tier, the wholesale tier. So I often, and I probably should change this slide, so it is an hourglass, because that's how I think about the three-tier system. You have the producers at the top, and then you kind of close in tighter at the wholesale level, and that's where that tax collection happens. That's where tainted products are tracked and identified. And then from the wholesale tier, it fans out to the retailers. And it's really critical if at the retail level, there's an, consumer identifies that there was a product issue or a tainted product did enter the market, you go back to the wholesale tier to track where did that product go in the country, and let's get it off the shelf if in fact the product is tainted. So that's the beauty of this three-tier system. And it's really foundational as we move through e-commerce to understand how some of this is being dismantled in this country. This operates as a background. We really are a victim of our own success in the U.S. with this particular system, because most people don't even know it's operating in the background, but it has extremely important public health and consumer protections built into it. All right, so with direct shipping, this is important. When we say home delivery, we say e-commerce, we have to unpack these things. Alcohol is being delivered to the consumer in a number of ways, one of which is direct shipping. And that happens through common carriers. This is the language you're going to hear in your own states as these topics are being discussed. So I'm using that language so we all are on the same page and know what we're talking about. So producers are using common carriers. FedEx and UPS are the only two in that space right now. The USPS is not. Just FedEx and UPS. They are known as common carriers, and they transport the product to the consumer. When that happens and states permit this and allow this, you are removing the wholesale tier and the retail tier from the equation. So the three-tier system is now broken, and it's just the producer, common carrier, to the retail, to the consumer. Now you can imagine some concerns that we would have. How do we ensure we collect the taxes owed to the state? How do we ensure we can track tainted products if they do enter the market, given that happens at the wholesale tier? You also might be thinking, how do our common carriers train for, best practices in carding? That's often retail responsibility. What happens if a sale happens to a minor? Is the common carrier accountable, or is it the producer? These are really important questions that are really still being answered across the country. The next primary way alcohol is being done through home delivery is through third-party delivery apps. And also retailers are using platforms like Drizzly that they don't take possession of alcohol, but they do facilitate the sale online, and then the retailer, through their employees, deliver the product to the consumer. In this context, the producer, the wholesaler, the retailer are still intact. So the three-tier system remains intact. So you have those opportunity to collect taxes. You have the opportunity still make sure you can track down tainted product. But in the retail landscape, then it becomes important to understand, are third-party delivery apps drivers trained? Is it the overarching company of that app, Uber, for example, or Amazon, that are held accountable, or is it the delivery driver that's held accountable if there's an illegal sale that's made? How are they carding? Are they trained? Are they certified in training? Does the state require that? These are all really, really critical questions that, again, are still being discussed and are varied quite significantly across the landscape. And in both cases, for direct shipping or third-party delivery, you have it's not always all beverage categories, as you can see here. So this is a snapshot from SAMHSA, the report to Congress in 2018, which means this is 2017 data. And we know this is an area of policy that's moved rapidly, so this is out of date, but it is the best we have at the moment for a snapshot, certainly prior to COVID. And of course, through our interactive dashboards on NABCA.org, you can see kind of what's happening in the current moment. But this is pre-COVID, it gives you a sense. So here you can see that the majority of states did not allow home delivery of any beverage category. And remember, this is how we regulate alcohol in this country. We don't think of alcohol just sort of as all alcohol. It is very much down to the product level. So beer, wine, spirits. There's a different tax rate. These products are sold in different locations. So this is just kind of the structure we have. So here you're going to see it broken down. Home delivery in this context is defined only by whether the retailer is permitted to deliver to a consumer's home. It does not account for the third-party delivery apps. So this is really important to know how they were, how SAMHSA was coding this to shape this particular map here. So again, most states were not, prior to COVID, permitting home delivery of alcohol at all, but the states that were permitting it, as you can see in the dark blue, the navy blue, they were permitting all beverage categories, beer, wine, and spirits. So we talked about some challenges along the way, but I'm just going to hit on this here briefly. How do we ensure proper alcohol excise and sales taxes are collected? That is a question that I can tell you law enforcement is paying very close attention to. Legislators and attorneys general across the country are paying very close attention to, because states want to get taxes that are owed to them. And if you're paying attention to the cannabis debate, that's a big point of discussion. If we legalize this product, we can tax it, and we can put those taxes toward services in our state and other treatment programs, et cetera. If you can't collect those taxes, if you don't have an efficient way to collect those taxes, then that benefit may not be as compelling. So having the ability to collect the taxes is critical. And we know it's documented that states are losing tax dollars through direct shipping. And there's many ways that's happening. That could also be a presentation on its own, but it's important to know this is in fact happening. How do we verify all direct-to-consumer operators are licensed, whether it be common carriers? There's something called fulfillment centers, which sort of serve as an in-between, and then third-party drivers. These are questions that some states require some states require licenses and permits to operate, but not all states. And so being able to understand the landscape, in part, a state, can then do licensing to have a better handle on who is shipping into their state and who is serving as a third-party deliverer. How to track the tainted products when needed. Again, I think I established a case for the concern, particularly around direct shipping. How do we track tainted products if we remove the wholesale tier that is required to do that? How do we ensure age verification is happening to determine who is responsible if illegal sales occur? These are really critical questions that sometimes are not being brought forth in the policy debates in legislatures. And they're valid concerns and valid things to be considered as the policy is getting shaped. And I bring that to your attention because the people who are going to bring that to the attention of decision makers is going to be people who are concerned about public health and prevention typically. So it's very important to engage in these conversations, to bring that lens into the debate, if you will. And then finally, what type of enforcement efforts are possible in this new market? And what kind of time and resources does it take to do a compliance check for home delivery? What is best practice in monitoring direct shipping sales that are coming into your state? Are audits being done in the regulatory landscape to track these things? All important questions. Again, when we pass policies, we need to make sure we can also enforce those policies. So that is often not part of the conversation. And then when we have the conversation about can we enforce these policies, we also have to say, do we have the capacity? We know alcohol law enforcement is underfunded, and it hasn't been going in the direction of increased funding. And they have gained even additional responsibility in the context of COVID in relation to having to often also monitor facial covering and social distancing requirements on top of their daily tasks that they've already been given in monitoring the licensee community. So in that context, do they have the capacity to add on monitoring, direct shipping, and home delivery? These are all important questions. And again, prevention, public health, and I would argue public safety are best positioned to raise these concerns and have those talking points in these policy debates. So moving on to just quickly, again, going to touch on the federal courts, but I don't want to lose you all, and we want to get to these case studies that are coming up here shortly. So the 21st Amendment gave the states explicit right to regulate and tax alcohol as they saw fit. So that's why we have all these different laws, rules, and regulations across the country. But they are a bit in jeopardy because the federal courts are really challenging states to say, look, if you have these regulations on the books and you claim they are for protecting the public health and protecting public safety, then you have to be able to make the nexus, the regulation, to that outcome that you're trying to protect. If you can't make that nexus, you could potentially lose these important regulations. And so how you make that nexus is data collection, really powerful data collection, whether that be enforcement data variables or health outcome variables, but somebody in the state has to be thinking about how to collect these data so that you can make that rational nexus back to why you have the regulations you do on the books. So how do we balance the narrative in these alcohol policy debates? You know, it sounds great in theory to say it out loud, but how does it get done? And I believe it happens because we have good data, we have good science, and you have powerful stories delivered by authentic messengers to help make sure the public health and public safety talking points are in these conversations. You're frequently not going to be asked to the table. You have to come to the table. You have to know when these conversations are happening in your states and or in your local communities. And if you're not monitoring those things, I would encourage you to engage and monitor those aspects of your community. So when I think about policy, I went to public policy school at University of Nebraska, and I learned about this theoretical framework for policy change, and it just clicked for me. So I use it in presentations because I'm thinking perhaps it will click for other people. But it's Kingdom stream theory, so bear with me here. You have three streams. You have the problem stream, let's just say binge drinking, high binge drinking rates for adults. There's your problem stream. You have a policy stream. We know that there are, from CDC, the World Health Organization, from NIAAA, specific policies that are proven to work to change that outcome of high binge drinking rates. And then there's the political stream, which is often one that is overlooked, and it really cannot be overlooked because it influences these streams in a significant way. And the political stream is such that, I think we all know enough about what the political stream is that influences, but it's when these three streams come together, a policy window is open and the agenda is set. And the piece here, the policy streams don't necessarily, sometimes they are coming together organically and it just happens and you're ready and primed to open that policy window. But in other cases, groups are pushing those streams together, trying to get them to flow together to open that policy window. And neither one is better or worse. It's just these are the ways in which those streams can be converged to open the opportunity to set the agenda. And the agenda, of course, in the context for people who care about prevention of public health would be to reduce binge drinking rates or to ultimately protect the public from alcohol-related harm. So we're going to go, if time, 3 case studies, but for sure 2 case studies. And the first case study is based in Maryland. And I lived in Maryland for 6 years, was actively involved with the Maryland Public Health Association as just an independent citizen engaging in my community. And at the time, there was a situation happening specific to craft brewing in Maryland, and not unique to Maryland. Many of you probably have a lot going on with craft products generally, whether it be craft distillers or craft brewers. But in this case, and this is important to understand the structure in Maryland. In Maryland, they have local liquor boards in the county, at the county level, in some cases even at the city level. So there are 25 liquor boards across the state. But the chief alcohol regulator overseeing all those liquor boards is the comptroller, Peter Franchot, the comptroller. He is an elected official. Again, I'm talking about all the political aspects here, okay? He is elected. And he took on this movement for craft brewers to expand the laws to allow them to have more opportunity to sell their product. So here are some quotes that how he was framing the issue in the state. Quote, current laws and regulations pose an existential threat to the industry's future growth in Maryland, and with it, the jobs, economic activity, tax revenue, and tourism opportunities generated by this community of innovators and entrepreneurs. In the absence of comprehensive reform, Maryland's reputation within the national craft brewing industry will continue to suffer, and the economies of our neighboring states will benefit at our expense. Maryland's beer laws are antiquated, dysfunctional, anti-small business, and anti-consumer, end quote. Now, I'm guessing many of you have heard these same type of arguments, but what a frame, what a frame. And he took this sort of flag up as the chief alcohol regulator in the state to kind of lobby for these laws to be changed. And so he created something called Reform on Tap and pulled a task force together of 40 different members from industry stakeholders. They held public meetings, but no opportunity for public comment. That's important. They were open to the public. You could go and observe, but you could not engage in oral comment. And nobody from the public health or public safety community were on this task force. They were 2 elected officials. The rest were industry stakeholders. And they met several times at breweries across the state holding these public meetings. And they ultimately released, just days before Thanksgiving in 2017, a 12-pack of recommendations. And, quote, they say, the objective is to create a framework that benefits Maryland craft brewers, consumers, and large businesses, all of which contribute to an industry that has the potential to create even more jobs, generate revenue, and empower communities across the state through investment, end quote. The public health community, not having an opportunity to engage formally in public comment, sat back and watched and observed, went to these hearings, just listening. And all along, they were identifying their public health arguments. Alcohol-related deaths in Maryland have been steadily rising since 2010, nearly doubling between 2015 and 16 from 310 to 528. So again, data that tells your story. The economic burden of alcohol consumption, $5 billion in 2010 dollars. That's $2.22 a drink. These are CDC facts that they were able to, anybody can get these data. And state collects only $310 million in taxes. And only about half Marylanders drink regularly. So that measurement, of course, is current drinkers, past month drinkers. So only 51% of Marylanders are actually drinkers. So there's an important thing for regulators to always think about. And again, remember, the comptroller is the chief alcohol regulator, that you have to be thinking about the entire population, the consumers and those who don't consume the product. That's an important factor here. So the Public Health Association of Maryland brought those talking points. And they wanted a general understanding that as we increase availability of alcohol, you increase consumption, and you could increase those negative outcomes according to the scientific research that we know about outlet density. So, given this backdrop, what would you recommend? Remember, the timing of this was right before Thanksgiving. This 12-pack of recommendations dropped. And they're going to shape that 12-pack of recommendations into a legislative bill. That's the end goal for those recommendations. So what would you recommend the Maryland Public Health Association do to get their public health message talking points out that we just looked over? A, create an issue brief or a fact sheet. Write an op-ed. C, ask association members to contact their state representative. D, start a petition. E, meet with Office of the Comptroller. So just take a minute or two, and it looks like, Kristen, there's 5 minutes for this poll, but I'm assuming we'll be closing it before a 5-minute mark. But
oh, yeah. If you just tell me when, I'll close it, okay?
Okay, excellent. Sounds good.
You've got 5 hours to complete this poll.
Shouldn't take you that long, for sure. So just maybe 30 more seconds here. I'll give you a minute to take this, and then I will tell you what the Maryland Public Health Association decided to do. It's funny how you do these things, and just even 10 seconds of silence seems unbearable. So we'll close it here shortly. All right, Kristen, I think we're good. All right, let's see what folks thought the Maryland Public Health Association should do. All right, so a good chunk of you felt like they should create an issue brief and a fact sheet. 3 of you thought write an op-ed, and then another group said meet with the Office of the Comptroller, and then another on asking the association members to contact legislators. So, you know, none of these are wrong. As you might have come to a conclusion, any mix of these things would be certainly helpful. But what they opted to do was write an op-ed. And there was a number of things that weighed into that decision. Creating an issue brief and fact sheet. Remember, this is November, late November, right around Thanksgiving. to, in the legislative session was going to start in January. So writing an issue brief, while yes, it could be helpful, they really needed to act quickly and quickly to get their message out to legislators. And while some people are not reading the newspaper anymore, I guarantee legislators are absolutely reading the newspaper. So asking association members to contact their state representative, this really wasn't within the legislature yet. But certainly, down the line, that could have been a strategy later on in the process. And I can tell you it was certainly a part of their strategy. Starting the petition could have happened, and of course, meeting with the Office of the Comptroller, but given his sentiment and his the way he shaped that task force with all industry stakeholders, he wasn't overly eager to listen to those public health arguments. In fact, he actually said, this is not a public health issue, this is an economic issue in a different news article. So he wasn't real receptive to that talking point. But their op-ed got them immediately in front of key legislators in the state, and it opened the door for significant opportunities for change. And this op-ed, which ran November 29th, so keep in mind, they dropped the task force recommendations on November 27th, and they were ready to position an op-ed in the main paper of the state. That does not happen by accident. They were prepping and planning for a moment like this. That's important to know. They were paying attention. They were having conversations with the editorial board of the paper to say, if we wrote something like this, would you be receptive to it? And then they timed it accordingly. This was written by the Maryland Public Health Association president, Rainey Eck, and she's been a long-time alcohol policy expert in the field, so maybe some of you know her. She's now at the National Cancer Institute. So this op-ed provided them an opportunity to be interviewed on an additional media outlet, the Mark Steiner Show, which again is something that the legislators listen to all the time. They were invited to meet with the chairman of the Economic Matters Committee. What's important about that committee is that it is the main committee that sees all alcohol legislation in the House. That's a very important committee. How did she know that? The Maryland Public Health Association is a volunteer-based group. It does advocate for public health change, but it has no staff. And so their understanding of the legislative process in Maryland and who the players are and which committees are important and key at any given time, they know that because they've hitched their wagon to a person who knows the legislature inside and out, is very engaged as a lobbyist himself, and works on public health issues. That is a helpful ally to the Maryland Public Health Association to understand the larger context of the legislature, to know how to navigate their own agenda. And then finally, the alcohol-related legislation, except for taxes, goes through this committee, as I noted. So it's a very important committee. And the backdrop here, I think let me tell you about the backdrop. So the piece that's really important, that we talked about the problem stream, expanded access for craft breweries. The policy stream, they really had concern with that expansion because of what we know from the scientific literature that says about expanded access increases consumption and ultimately could increase harm. But the political stream was what might have been the most important part of the story. And that is that the comptroller is a Democrat. The legislature is largely Democratic in the state of Maryland. The governor is a Republican. The comptroller is part of the executive branch, aligned often with the Republican governor. The comptroller really pitted himself on the side of breweries and said, legislature's not fighting for you. And so he pitted the legislature, Democrats, against him. They were very frustrated with him. Now, the Maryland Public Health Association didn't necessarily know that was going on or that there was that sentiment. But their policy contact in the legislature, who lobbies regularly, understands all the inner workings, did clue them in to that later, and which ended up being very helpful. But ultimately, the comptroller really upset the legislature. And while the Economic Matters chairman had sensitivity to the public health arguments, he also really, really was frustrated with the comptroller. And so when this op-ed came out, and there was legitimate arguments for why you may not want to go down the direction the comptroller wanted the legislature to go, and those were public health arguments, that helped the legislature make their case for why they were going to kill his proposal and not pass it. And that is exactly what happened. The legislation did not pass. In the hearing, there were 70 breweries that came to testify on that bill. And there were a handful of public health folks, but the Maryland Public Health Association did in fact encourage other organizations across the state to engage in this conversation. Again, they are a volunteer-based group, so the advocacy and lobbying considerations that many of you probably have to consider were not necessarily a consideration for them because they have a volunteer base of folks who can do that advocacy work. So that's just something to consider and think about as you engage in these policy discussions. But certainly they could have merely educated lawmakers about the public health impact and not necessarily talked about the legislative proposal and still got their public health talking points out to those policymakers. Even when you have the constraints of not being able to lobby, you have to be able to still have a conversation with policymakers and educate, and that is perfectly reasonable. And of course, anybody can take time off of work and be a citizen and share their knowledge on a particular policy, and that's often a role I play in my own personal capacity. So Maryland Public Health Association, which is an affiliate of the American Public Health Association, was watching, they were tracking that, they knew the problem. That was clear to them. They knew the policies inside and out. But it was the political stream that they really got more knowledgeable about and tracked more closely, and they were able to open that policy window. And today, as it stands, they have passed, with these legislative colleagues, they've passed legislation to establish a new task force that truly did study alcohol laws in Maryland from a public health and public safety perspective, with a much more balanced task force. From that task force, public health recommendations were laid out, one of which was to remove the comptroller as the alcohol regulator in the state, and that passed. And now it will establish a new alcohol and tobacco commission, because he also oversaw tobacco. And that commission will establish best practices for the 25 liquor boards and create some uniformity across the state for what is best practice to protect the public in relation to alcohol sales. So this now, 3 years later, is still, certainly has positioned the Maryland Public Health Association as sort of the public health authority on alcohol policy in the state, and an active voice in these debates moving forward. And they were then able to take what was going to be a challenging bill into a bill that ultimately helped advance public health. The next case study is Pennsylvania. And in Pennsylvania, there was a proposal to expand spirit sales. Now, Pennsylvania is a control state where the state is in the business of selling spirits and in retail stores, and they wholesale the product. And so just important context to know. And typically states that are controlled jurisdictions that sell spirits at retail have fewer locations that sell spirits. That's typically how it is structured. And the expansion of spirit consumption alarmed prevention groups in Pennsylvania for a number of reasons, but maybe most prominently was because of the college community. Pennsylvania has a very large college demographic, and they saw that quickly the Interfraternal Council and some of the universities had already identified spirits as, or high ABV products, alcohol by volume products, as very, very dangerous for student population, given the alcohol poisoning incidents that had happened. And there was one very prominent incident at Penn State in the recent past. And so when this proposal hit about expanding spirits, this prevention group really wanted to sound the alarm of why it mattered about spirits specifically. So they used these types of headlines to make their case. But before I tell you what they did in this scenario, I would really love to hear again what you think you would recommend. Their name is the Commonwealth Prevention Alliance. What would you recommend the CPA do to share their concern? Should they write an op-ed like the Maryland Public Health Association did? Remember, this piece of legislation had already been introduced. Should they encourage coalition leaders to contact key decision makers? Should they create a resolution of support to garner support for public health and safety policies? Or should they send a letter to all decision makers to share their concerns? Again, no right answer, wrong answer, but curious to hear from you all what you think would be your recommendation to the Commonwealth Prevention Alliance. Remember, the policy has been introduced. There's actually 2 legislative proposals already introduced, already being pushed through the session, and they are concerned about it from a college demographic standpoint, a college drinking issue. All right, Kristen, I think we're good to close the poll. Okay, so many of you thought encouraging coalition leaders to contact key decision makers. Also, several of you it was even split between B, C, and D. So again, any of these would be reasonable things to do if you're trying to garner attention to your talking points. But what they decided to do was encourage their coalition leaders to contact decision makers for a couple of reasons. One, they have a broad network in the state. They have 4 regional subcategories. They have an advocacy committee. They have a executive director, a staff paid person to organize quickly and to craft talking points for these coalition leaders to have those talking points to talk to decision makers. So they are in a higher capacity from a staffing perspective, and regionally have these structures that can easily get information to key coalition members to then act and move forward. So they're starting at a different position than the Maryland Public Health Association was, but they also, the bills had already been introduced, so they really needed to make sure that they acted quickly and got constituents to their legislator. That was key from that perspective. And if you could, they were also focusing on the committee that the bills were before, because of course they had that sort of first line of defense. If you're working in policy, usually it's being discussed at the committee level, and then it goes onto the floor. And so if you are not wanting a particular proposal, stopping at the committee level is obviously going to be key. And that's what they were trying to do. So some of the data that they used to make their case was to show that, binge drinking is problematic, that Pennsylvania 18 to 25-year-olds, this is the age group that's binge drinking the most. And also they were able to even show that within one particular county, because in that county, Center County, that's where Penn State University is, and they were able to show, 20 to 24-year-olds, that's the largest, whether male or female, that was the largest demographic that was binge drinking. And also that's the largest population in that county. And then they also wanted to show, where are these universities and how will this impact, this expansion of spirits impact these particular areas where there's large group of college students living. So they looked at the post-secondary education locations, and then they mapped them. And then they looked at, this is where the college population is most dense. And they looked at excessive drinking rates across the country, and not probably surprising to any of us that is also where heavy drinking was taking place in the state. So looking then at how these impact the expansion. There were two proposals to expand spirit sales in the state. And what you would have seen here is that this is where currently spirits were being sold in the state. So you had the number reflects how many stores are there that sell spirits, and the deeper the red, the more locations, the more yellow color, the lighter, the fewer locations that sell spirits. But over the entire county, state, there are only about 57 locations selling spirits today. So one of the proposals would have increased that to over 1,000 locations. So the current 660 plus 1,000 additional locations that would have sold spirits. The second proposal would have increased it a little less, but about 945 locations would have been selling spirits. And these combined would have increased the total to almost 27, just over 2,600 locations selling spirits from, again, the original, let's go back, the original 660 locations. So they use this data to really paint a picture down to the local county level with the frame of college drinking is a problem. We're concerned about that in our state. There was a recent tragedy specifically with spirits that really helped them make the case for why they felt this was a dangerous policy for particularly for a subpopulation group. And they were well organized within the state to make that case. And ultimately, these policies did not move forward. Now, I'm sure they played a role, but they also are not, they don't have a lobbyist down in the legislature. I know some prevention groups like in Ohio and New Hampshire, they do have a lobbyist down in the legislature. But in this case, in Pennsylvania, they do not. And so they rely on somebody who they know who is down in the legislature all the time, that they have regular conversations with, who feeds them information about where the bills are going, how likely they are to pass, are they being reshaped and flipped in as an amendment to a bill. All of these factors and nuances are critical to engage in these policy discussions. And that's that political stream. So they knew they had a problem. They knew the policy that, expanding spirit sales was going to impact, again, especially college students, and increased consumption potentially and increased risk. But they also understood the political stream as well because they knew which committees this was going to. They knew their leanings of those particular legislators, and they acted accordingly. And they knew that information not because they knew it independently, but because they have regular conversations with another entity that is in the legislature regularly. And this particular entity also did not want these policies to pass, so they were willing to share that information readily. You might be catching on to a theme here about just because you don't know what's happening in the legislature doesn't mean you can't know what's happening in the legislature intimately. And that doesn't always have to take shape in the form of a registered lobbyist as representing your organization, because many, I'm sure, on this call, just like certainly organizations I worked at, we didn't have that either. So the final case study, and I think we actually do have some time, so I'm gonna go into this particular this particular one, is in Alabama. So right here in the Southeast region, and this particular case is that Alabama is a control state. And Alabama had a lawmaker who was carrying the flag to privatize the state system. So for those of you who were not on the call, or rather the webinar part one, we did a lot of understanding of what control systems are and licensed states. But just briefly, control states sell the product either at retail or wholesale. And in the case of Alabama, they do both. And so in Alabama, there was a legislative proposal to remove the control from the government agency and give it to the private sector to sell spirits in the state. So that's what was on the table here. And this was just in 2019. So when advocates or even, prevention groups were very tuned into this issue because they've been tracking this issue for a while, and they had somebody who used to work for a local paper who really understood politics and pays very close attention to the legislative process and has a good relationship and a deep understanding of the Alabama ABC, which is the regulatory entity. And so through information from the regulatory body, as well as their understanding of the legislative process, they understood what this threat could mean for public health and prevention. And they really hit, let me, before I tell you what they did, what would you suggest stakeholders do in Alabama to prevent the removal of government control of alcohol sales, which is, again, known as privatization in the state of Alabama? So should they, A, create an issue brief outlining their concerns? Should they encourage stakeholders to contact their elected official to share their concerns? Should they meet with legislative leadership to share those concerns? Should they place an op-ed and ask others to write letters to the editor? Or should they do all of the above? What do you think was their next move? Again, what would you suggest stakeholders do to prevent the removal of government control of alcohol sales, privatization, Alabama? And also, if you weren't on the prior part one, we talked about the fact that, privatization of government-controlled sales is what CDC would recommend states not do. There is evidence that the control model in those states, there's lower drinking rates, fewer locations selling alcohol, and as a result, they have lower harms. And so that would be the rationale from the CDC public health perspective for why states should keep the government control and not privatize the system. So in this context, the prevention groups understood that, and they wanted to keep the government control of alcohol sales. All right. You can close the poll, Kristen. All right, all of the above. And, all of these certainly would have been helpful strategies for the group to take, but what they opted to do was an issue brief, because what they knew was that most people in Alabama who work in prevention did not know they were in a control state. They didn't know what that even was. There was little understanding of this policy and what the value of the control model was for the state of Alabama. So they had some work to do from an education standpoint of their prevention community. The bill was introduced, so, there could be an urgent nature to the need for their response. However, the bill was not very supported by the leadership in the legislature, and it wasn't moving quickly. And they only knew that because of the kind of intel and their understanding of the legislative process, the committee that was seeing this bill come through. So they had an understanding at how urgent was this moment, and they knew they had time to do education. And so that's where they focused their energy. And primarily where they focused their energy was to talk about the revenue. When you have a control state that sells the product, the revenue from the sale of the product goes back into the state general fund. So in the case for Alabama in 2018, they contributed over $100 million to the state general fund, which the general fund certainly does do a number of things. Of course, it provides services across the state, but the money actually goes to several subcategories. So most pointedly, I would want to point you to, it goes to the Department of Mental Health, 9% of it. And 2% of it goes to the city and county funds, which then help support enforcement and other types of services. So these dollars, it was really important for them to help the public better understand where the money goes, because there's intrinsic value in the revenue for prevention of public health and public safety, given where the dollars do go. And so they wanted to help the public understand that. But also for legislature that may have a budget shortfall, or they have to consider, how do you close that gap in funding? How would you take $116 million out of the budget, and how would you make that up? That is is a very important question that any state that's looking to privatize has to answer that question. There's only one state that has fully privatized its system, and that's Washington State in recent years, in 2011, and they had to raise their alcohol tax substantially to cover that lost tax revenue. And now states like Alabama know that information, and they use that in their framing, which of course was in this issue brief. This is just a sampling of some of the data points that they had. But they also identified that in Alabama, they are 48th in the country for per capita alcohol consumption. Not this is about across the board, but adult consumption. So they're 48th in the country, 48th lowest in the country. So that's, a good place to be if you care about prevention and consumption rates. But they're number 3 in alcohol tax collection. Number 3 in the country. So their talking point was that Alabama strikes the right balance, ranking high among U.S. states in tax collection and low in the nation for per capita alcohol consumption. That, to them, they said, this was the sweet spot. We hit the right mark. Why would we want to change our system when we're doing it well? And we're protecting the public, and we're still getting, we still have an efficient way to get the product to market. And we have revenue that comes back into the state that goes to important services, and Department of Mental Health in particular, the prevention community hung their hat on. And this bill did not make it across the finish line. So they were part of the equation of, trying to educate decision makers and other prevention groups in the state for why this could be a detriment to the state ultimately. And what they also did was increase capacity for the state, for preventionists, because then they understood the control model and the value of this particular prevention strategy in the state. So before we open it up here, or rather I go through my takeaways and then we go to question answer, I am curious to hear if any of you have personally engaged in alcohol policy discussions in your community or in your state. So here's a couple examples. A, you've provided or organized others to provide testimony on a state or local bill. B, served on a task force or working group related to alcohol policy. C, attended an alcohol regulatory meeting and or hearing. D, wrote an opinion editorial or letter to the editor on a policy topic. Or E, you have not personally engaged in alcohol policy efforts, which is perfectly fine. It's just, it'd be helpful to know if anybody has had experience in any of these capacities. Just take a moment.
While everyone's filling out the poll, I do want to remind you, if you have any questions for Cassie, please post them in the chat and we'll read them out to her so she can respond. Take advantage of her being here live and in person.
Yes, I think our last webinar, that was perhaps one of the most fruitful takeaways happened was in the Q&A. So definitely, please ask away. Or if you have general comments about your own experience with policy, happy to hear that too. All right, looks like we can close the poll. All right, so a majority of you have not engaged in policy, and I am not all that surprised, to be honest, because often as we work in prevention, that's just not an area that either we feel comfortable in or we're tracking it closely. But here's the reality. You may have your coalition deliverables. You have your grant, you have to do compliance checks, for example, but you're operating in a larger context where these policy decisions are happening. And I would encourage you, if you want to see a more balanced conversation and also more balanced policies in the end, there is nobody else better to make those cases than prevention and public health and public safety. But you have to be paying attention to the streams. You have to be paying attention, reading the newspaper, because that's where a lot of this stuff is being discussed regularly. And you have to have an ear in the legislature or the city council to really understand what's going on to begin engaging in a meaningful way. So, yes, you have your grant deliverables. Yes, you have to do compliance checks and responsible ever service training, for example, may be some of your strategies. But again, you're operating in this larger context. So here you are doing compliance checks and asking law enforcement to do that in the brick and mortar stores, but you have a whole bunch of alcohol sales happening in home delivery. you're missing a big opportunity if you're not paying attention to that larger context. Or if a policy is moving forward, like recently did in North Carolina, where they're looking to allow home delivery and they're looking for rules and regulations to control that environment, prevention could weigh in and talk about, well, training is important and who needs to be trained and how often they need to be trained and who is held accountable if an illegal sale happens. These are the talking points of prevention, and there is nobody else typically who's going to raise that if it's not coming from prevention and public health. So there is a missed opportunity if you're not thinking about that larger context in which your coalition is operating within. So that's my pitch for people to get engaged in this stuff. Plus, it's kind of fun once you start doing it. Okay, so a couple takeaways, and then we'll close it out with some Q&A. The first is that, and some of these might feel redundant, but they're worth repeating, awareness and engagement. That monitoring that policy landscape is critical to really shaping the policy environment. And that monitoring starts and can be done in many ways. It can be done by the coalition. It can be done by volunteers. It can be done by a colleague or, and other folks that you may know who are intimately involved in the legislature. And it could be building a relationship with a legislator who cares about these issues, who will also share information as things come down the pipeline. There's lots of ways this can take shape in terms of how you monitor that landscape. Engaging in policy discussions to provide those public health and prevention perspectives. Again, nobody else is going to do that for you, and you're also not going to be asked to the table. You have to just go to the table. Remember the Maryland story. They were not asked to come to the table. They watched, they inserted themselves, because at the end of the day, it's too important. Lives are at risk here. This is what we're up against. So it's important to think about what are we really trying to achieve when you think about your work in prevention. Obviously, what we're trying to achieve is protecting the public health and save lives. And so that requires getting involved in these conversations, engaging in these policy discussions, sharing your wealth of information, especially if you have that at the local level. That's fabulous. Identify and collect data. Every single case I talked about, they had powerful data to back up their points. And they had economic considerations in Maryland. They talked about the tax collection and the lack of tax collection and the impact alcohol has on the public coffers. But then in Alabama, they talked about what that lost tax revenue, or rather the lost revenue from the sale of the product, with how that would impact. So you can see they identified strong talking points based on the context of their state. And then finally, encouraging others to join you, which I know it can be hard to get people to want to care about alcohol policy. Sometimes other substances take precedent, but we also know the data is strong that in alcohol there are much greater numbers in terms of the harms, and it's a product that is widely consumed. And so it is certainly worth identifying those hooks, as I like to refer to them. So if opioids is an issue in your community, there's a way to frame the alcohol policy debate within that context. It's just, and I have some presentations even on that, but encouraging others to join you is going to be important, because you have to have authentic messengers to share those data and to inform legislators to speak from their lens, from their talking points. And then the second piece I would leave you with is just the need to support enforcement. We really, as expansions happen both for brick and mortar stores, but also home delivery and direct shipping, do we have adequate resources to expand? These are important questions that need to be raised. And how do you support law enforcement partners to innovate new operations appropriate for new markets like home delivery? There's some resources that are being created through the National Liquor Law Enforcement Association and the North Carolina Alcohol Law Enforcement Agency, and they're creating a training around compliance checks and around home delivery. So I think that might be a webinar coming to you soon. I think they would be very open to delivering how to do that, but that's the innovation we're talking about here. We're in the midst of COVID, and you can't do the traditional compliance checks perhaps, but there are other ways to get enforcement efforts happening in this current moment. And the National Liquor Law Enforcement Association can be a valuable resource for you to understand how and what those resources are. And finally, there are some states that are using technology in some really neat ways that are bringing big data to help into one sort of repository, creating dashboards to help inform where problems are highest in terms of youth access or problem alcohol operators, and that data helps inform where regulation and enforcement need to spend their time, resources, and so really helpful from a resource allocation-based standpoint. And the state I would point you to is the state of Vermont. The Department of Liquor Control has been using big data to inform their practices, and it is a phenomenal tool, and it's replicatable. That's the cool part. It is replicatable. So if anyone's interested in that, the National Liquor Law Enforcement Association can certainly help you get information related to what Vermont is doing on that front. Okay, I think that's it for me. So I will open it up to questions at this point.
Wow, thank you so much, Cassie. That was absolutely terrific.